Have you been told that you have bone-on-bone arthritis or disc degeneration, osteophytes, facet arthrosis, or degenerative disc disease? If so, don't panic. Today, we'll clear up all of the conflicting information about arthritis and degenerative disc disease. So let's get moving because, spoiler alert, movement is part of the solution, and motion is literally lotion for your joints. First off, let's get our definitions straight. Arthritis is a term that includes a lot of different conditions like osteoarthritis, rheumatoid, psoriatic, gout, ankylosing spondylitis, and many more. But this video will focus on osteoarthritis, or OA, because it's the most common. If you see degeneration on an X-ray or an MRI, it's probably osteoarthritis. So OA, or degenerative joint disease, or bone-on-bone arthritis, right? Some of those names are really scary and they make osteoarthritis sound way worse than it actually is. So what exactly is osteoarthritis? It's honestly just a normal part of aging. It's kind of like wrinkles, right? Your bones, your joints, your body changes as you age. Now, in the lumbar spine, arthritis usually impacts the facet joints and the vertebral disc joint. Now, this video is going to focus on the facet. We'll save disc degeneration for another video. Now, in kids, facet joints tend to be smooth with lots of space between them. But as we age, the space decreases and they grow these little nubs on the side of them called osteophytes. Now, in addition to age being a risk factor, we also see that genetics and inactivity and being overweight all play a role, as well as many other factors. Traumatic injuries also contribute to the development of OA, and facet arthritis may or may not cause pain or disability. I want to repeat that. Arthritis may or may not have anything to do with pain. Most of the time, it's a normal finding on an MRI. That said, when it is symptomatic, common symptoms are, pain with certain movements, especially bending backwards or extension, limited range of motion, radiating pain that stays above the knee, kind of tricks you out, feels like sciatica, but it doesn't actually go past the knee, it's just joint pain. But this is not always the case. So a recent study looked at adults aged 20 through 69 with no back pain and found that 37% of them had lumbar facet osteoarthritis. And this review study summarized 33 articles and found that 9% of 30-year-olds and 50% of 60-year-olds had facet arthritis. And again, none of these people had back pain. And then this systematic review looked at what MRI findings correlate with low back pain, and they found no compelling evidence that facet arthritis correlates with low back pain at all. So having arthritis does not doom you to a life of pain. You don't need to fix it, you don't need to get it adjusted, your joints are not worn out, and you don't need to do any magic corrective exercises to solve it, or get joint injections. And this is all doubly true if you don't actually have pain. But you're probably watching this because you do have pain. So how do you fix it? Hey, real quick, if you're new here, I'm Dr. Anthony Davis, and I empower people with chronic low back pain and sciatica to reclaim the active life they love. If you want to know more about working with us, watch the free masterclass. The link is in the description. So how do you fix your back pain? Well, the first thing you should do is get an MRI or an X-ray, right? No, not at all. Slow down. Unless you have red flags like a history of cancer, fever, sweats, chills, trauma, your hair is falling out unexpectedly, then getting an X-ray or an MRI is pretty much useless. We would treat back pain with facet arthritis the exact same that we would treat back pain without facet arthritis, because the arthritis itself basically doesn't matter. It just gives you a scary image that you can't get out of your head, freaks people out, makes people afraid of movement, and makes pain worse, right? You've heard of a placebo. Well, a placebo is a treatment that doesn't actually do anything physically, but mentally it makes you feel better because you believe in it. Well, scary X-rays and MRIs, you see that image, it's terrifying, right? And your doctor presents it and tells you that you're broken. That shouldn't have an impact, but it does, because it freaks you out. It makes you feel fragile and scared, and it actually makes pain worse. So if getting imaging is not the solution, then what is the solution? Well, Duh, exercise. Motion is lotion. Movement literally lubricates the joints by stimulating the synovial membranes around the joint capsules and produces more synovial fluid and pumps fluid in and out of the joint space. Motion is literally lotion for your joints. And this old wear and tear model is outdated and false. You are not a machine. Your joints don't just wear out like a car with too many miles, okay? Your body is a living ecosystem. It adapts to stress and actually gets stronger. That's why people who are physically active have bigger muscles and stronger bones and thicker cartilage, meaning healthier joints, right? Joints love movement. And exercise does not increase arthritis. In fact, here's a study of elite CrossFit athletes, female CrossFitters, and they have the same rate of facet arthritis as the general population. And then here's a study showing that retired professional soccer players around the age of 56 actually have lower rates of facet arthritis for their age. So that's 10%, which is what you would expect to see from a 30-year-old, right? So they have healthier spines than inactive people. Now, most of the data on exercise and sports and osteoarthritis is from other body parts, but research suggests that like hockey, wrestling, football, they do have a higher risk of arthritis, but it's probably because those are sports where somebody else is physically trying to hurt you or take you out or harm you in some way. So it's just injury risk. But with sports like running, non-contact sports, we see like this systematic review shows that being a runner does not increase people's risk of developing knee osteoarthritis, as an example. And in fact, there is evidence that non-runners have a higher risk of knee replacements. So we know that weightlifting, as another example, is very helpful for elderly people with lower body osteoarthritis. So exercise is amazing for chronic low back pain, and having facet osteoarthritis in the spine doesn't change that. In fact, hyper-focusing the treatment on the facet joint itself doesn't really seem to help. So the most recent low back pain guidelines recommend against using lumbar facet injection. So if literally injecting pain medication directly into the facet joint doesn't even help low back pain, then we probably need to take a little bit more of a zoomed out approach. So what type of exercises should you do? Should you A, do this program that has the 5 best low back pain exercises for everybody? Or B, take a systematic whole body exercise approach that gradually progresses from easy to medium to hard exercises over time and progresses you at a pace that is right for you. Obviously, the answer is B, because there is no magic exercise that works for everybody every time. That's why, like in our Beyond Back Pain program, we help our clients adapt their program to fit their body, their exercise tolerance, and their goal. And most importantly, along the way, we teach people what type of symptoms are safe to push through versus which symptoms are a sign that they're doing too much too fast. So start with slow activities that are meaningful and then gradually increase over time, and get out of rehab purgatory, which is where you endlessly try to fix your posture, alignment, pelvic tilt, core stability, hip hike, knee valgus, and all these silly things that are not evidence-based. I have tons of videos destroying these outdated myths. And look, as far as exercise is concerned, you might be already thinking like, I've already done 4 weeks of physical therapy. It didn't work. So how is exercise going to help me? Well, you either didn't do it long enough, you got the same cookie cutter plan that they give to everybody, and or they babied you. They never challenged you to get truly strong. And you need to be willing to be patient with gradual progression over time. You need to commit to being active for the rest of your life and improving your recovery, lifestyle, sleep, nutrition, and stress, right? Just 4 weeks of PT that the insurance companies cover is just not gonna cut it for most people. For example, let's say that golfing causes low back pain, but it's your favorite activity. Okay, so golf is a twisting sport, done from a hip hinge position. So you need to be able to hinge and twist with safe pain or no pain before you can get back to golf. So your exercise plan might include some hip mobility, so that obviously you can rotate through the hips in order to golf. You might include some spinal twists in order to help the joint movement and tolerance for rotation. And you might include deadlifts to strengthen your back in a hinged position. So, all right, that's the short story on exercise. Obviously, there's a lot more to it, but you also need to look at lifestyle factors. Now, I know this is not a popular opinion, so we're gonna keep the emotions out of it. Let's just look at the research. But if you are overweight, does that have something to do with back pain? And the research shows us, yes, that should be a high priority for you to improve your body fat percentage. So this study showed that for every 11 pounds of weight gain, people had a 36% increased risk of developing osteoarthritis. Now, the good news is the reverse is also true. So just 5% loss of body weight can alleviate joint pain, and the closer people get to a healthy body fat percentage, the more pain relief that they experience. Now, quick note on that, because I know it's a sensitive topic, pain related to weight gain is likely not just because of the physical extra weight, but rather due to the fact that fat tissue itself is pro-inflammatory, plus the fact that obesity itself is highly correlated with sedentary behavior and other lifestyle factors like poor nutrition. So it's likely not the weight itself, but the other underlying sedentary behavior and systemic inflammation that are contributing to pain that happens to also be correlated with weight gain. Now, on top of weight loss, we also want to make sure that we're focusing on really just being a healthy human, right? Quit smoking, eat healthy, get at least 7 hours of sleep per night consistently, and take care of your mental health, anxiety, stress, depression. These things dramatically impact back pain, way more than you think. So yes, as far as other treatments, yes, you could do chiropractic adjustments, massage, acupuncture, NSAIDs, etc. But these should not be the main treatment. They should be like a side dish if you have them at all. So today we learned that you should not be afraid of spinal osteoarthritis. It can be a small piece of the pie in terms of why you might have pain, but it's a very small piece in a very big multifactorial pie, and in most people it does not cause pain. So for those of you who do have pain, you don't need to fix the arthritis in order to improve pain and quality of life. Just moving more, managing your weight, making healthy choices, getting good sleep, reducing stress, anxiety, and depression can go a long way towards improving your symptoms and your quality of life. Now, if you're wondering how it is possible that pain can happen without damage, and why arthritis usually has nothing to do with back pain, I want you to watch our pain neuroscience mini-series where we break down the science of chronic pain. The first video in that series is appearing on your screen right now, so click that, watch that one, and I'll see you in another video.